Good morning, folks. John Adamson, the Rehab and Documentation Guru, bringing an interesting case study to you today. Saw a patient the other day. She has an old upper thoracic injury to her spine, which resulted in complete hemiparesis and hemiplegia below that lesion, so upper thoracic. She also developed a wound on one of her ischial tuberosities, a pretty severe one. But at the same time, she's also had some other medical complications in the past, including her opposite limb, lower extremity, was fractured at apparently the mid-femur. ORIF was performed. And I was referred to her because she had some range of motion concerns. She was getting contractures. So anyway, I went in and I evaluated her, and I encountered a lady in her middle age who was sitting in an electric wheelchair who had profuse sweating. She was complaining about the fact that she was sweating. And we were kind of kidding a little bit about whether, is that just time of life for her? And she said she didn't think so. And what was interesting was she was sitting on a chair. She's got the one side with the wound that she's sitting on with not a very good cushion. The other hip has this history of ORIF. So anyway, I got her in bed to assess her range of motion, and I noted that as soon as I tried to range her left hip, which was the old fracture side, I got a lot of cracking and popping at the hip. And so I stopped. And what was interesting is this lady who is insensate was clearly evidencing discomfort when that hip was ranged. Shouldn't be feeling that. She said she could feel some deep pressure stuff, but that was about it. So that got me a little bit concerned. Also, when she was supine, she commented on this, and then I thought, that's interesting. She stopped sweating. As soon as she lied down, the sweating went away, and I also noticed that her demeanor seemed more calm. So, what am I to surmise from this? What's going on? I suspect that she was having some strange nervous system reaction. She's having a sympathetic nervous system reaction, possibly. And now, normally, if you have sympathetic dystrophy, you will have problems with elevated blood pressure, but her blood pressure, while she was in this diaphoretic state, was actually on the low side. And I almost equate it with being in shock a little bit. There was other findings that suggested her hip's completely out of joint on the left side, that cracking and popping. She had a significant leg length discrepancy. Her greater trach was sitting 3 inches higher than where it should have been compared to the contralateral side. Anyway, lots of weird stuff going on. And all I could surmise was she's having some kind of internal neurological event going on because her body can sense there's pain coming from both sites, both hips. She's not sensing it cortically, but her body's trying to respond to it. And that's not a good situation. Anyway, feel free to leave some comments. I can't recall ever seeing that in 28 years. That kind of response where clearly her body was in distress, even though she wasn't able to register it as pain. Feel free to comment. Any neuro specialty therapists out there that have some good perspective on this, love to hear what your perspective is. Anyway, hope you have a great day. Take care, and God bless.